Now, the module we're talking about is how to overcome paradigm restrictions, belief restrictions, motivation restrictions, and specifically we're referring to patient retention and fees, what you charge. And so this is how I recommend that you approach training yourself, your staff, future doctors, and in relative to, and we're specifically going to apply it to patient retention and money. That's what we're going to talk about right now. So first of all, there always has to be a belief system. We talked about the reasons that you'll do something, from the lowest reason, which is money, which is the worst reason, to personal gain, to conviction to duty, and duty is always the highest. So we always talk about how important it is to always apply it to a sense of duty, whatever it is you're doing. And in retention, that's what we apply it to. We apply it to why you're doing it, which is money. So number one is we talked about the three types of retention, which is more of the pain relief model, the functional capacity model, or the lifestyle model. And essentially the pain relief model, patients will stay anywhere from 4 to 12 visits, something like that. The functional capacity might be 18 to say, sometimes it can go as high as like 30, 35, but that's pretty rare. It's usually 18 to 25 usually. And then the lifestyle model, that's when patient retention can actually get up to 50, 60, 70, 80, that kind of because it's a lifestyle. It's not a component. So when we're talking about how to go into one of these categories, we talk about how important it is to not violate somebody's paradigm, your paradigm, whoever you're training it, because we talked about the importance of the 4 stages of learning, going from unconscious incompetence to unconscious competence, or conscious incompetence. And books, seminars, and tapes do that. And then we talked about going from unconscious or conscious incompetence to conscious competence. In other words, you kind of know it, but you don't have the skill to do it. And we talked about that category overwhelmingly is what stops people in life, in every category of life. And we talked about the importance of what stops us is our primary needs. So our primary needs of survival, physiological survival, and security that actually motivate us to do things now become very oppressive, stagnant reasons. In other words, after we're out of survival and security, we don't want to challenge our security anymore. And so it becomes a unbelievably strong, oppressive mechanism. And of course, the way most human beings deal with it is we go into denial, diffusive responsibility and denial. Don't accept responsibility. And that allows us justification, right? It's called rationalization and justification. Allows us to feel good about ourselves, but not achieving our goals and our dreams. So the point that I'm making here is when and of course, when we go from the conscious competence, we kind of know a skill set or knowledge, then it's repetition to get that unconscious competence. And so the first, the second, third, the fourth are really not that difficult. The second to third is unbelievably difficult. And so knowing basic training and psychology of how to get through that. So we're talking about really that right now. So relative to patient retention. So here's how we trained with patient retention. First, I'd always go to the doctors and I'd say, what is your, this is when they first started. I'd say, what do you think the average number of patient visits the average patient should see? And so I wasn't specific. I said average. I took out, older patients, younger patients, major injuries, minor injuries. I said average. I said, just take average. And that's very important. And a lot of people who have lower conviction or confrontation, that's when they start jumping around. That's when they go, well, what about this or what about that? Well, now you're getting into commitment issues here. And essentially that's people just backing away because they somewhat see what's coming down the road, that there's going to be some commitment involved here. So essentially what I did is I said, okay, what is your, and I personalized it. In other words, I said if it was your wife that had the problem or your mother that had the problem, and it was an average. In other words, I made it real to them and meaningful to them where it was high emotional content. And so I'd say, what is that number? And then I'd ask what they would base that on. And everybody has different answers of what they would base that on. And the real reason what it should be based on is the science of the 3 phases of healing. That's what all therapeutics are based on. In other words, why you do a certain therapy is based on what phase of therapy, of healing you're in, and what you're trying to accomplish physiologically. That's what all therapy is about, should be about. And that's called the science of the 3 phases of healing. It's not a philosophy, it's a science. It's not based on one particular profession, medicine or chiropractic or podiatry. No, it's how all of humanity heals, irregardless of a profession. So having said that, the first thing I would do when I worked with, and I did the same with staff, if I was teaching staff referrals or whatever I was teaching staff. But if I'm specifically referring to patient retention and money, prepays, this is very important how I did this. So I would start with what was that person's feeling. Because remember, it's your feelings, not your cognitive, that will hold you back. Cognitively, you could understand something. Emotionally, it will restrict and limit you. So I say, what is your visceral feeling? A lot of times I'd say, close your eyes and just think of a number. And I would just start saying numbers. I'd go, I'd typically go with increments of 3. Like, should everybody see at least one visit? And most people go, oh yeah, I'd have no problem recommending 1 visit. Okay. Well, how about, 4 visits? Well, yeah, for an average patient, an average problem, 4 visits. And then I'd go, okay, 7 visits. And then I'd just typically move it up like that, 2 or 3 visits at a time. And then what I would say is, when you start feeling, and then here's also what I did, is I would match it with money. In other words, I'd say, okay, what's an average fee for an average visit that you feel comfortable saying? If it's $1, I said, most of you guys, and I would even say, I'd go to the low numbers, especially to start with. I said, most of you probably have no trouble, recommending $1 a visit, would you? And that's like the obvious. Everybody goes, yeah. And then I go, okay, how about, $3 now? How about $5? How about $7? So I would do the same thing. I would just thermometer the number. And then I'd say, at what number? And again, I'm personalizing this number. In other words, if your mother, in other words, where there's high emotional content, your wife, your child, your mother went to a chiropractor's office, what would you feel comfortable that that person was charged? That they were, and I'm only talking about a chiropractic adjustment, no therapies, nothing else, nothing else. I'm simplifying this, very simple. And so I would say, and I'm getting them very specific, highly personal with visits, highly personal with money. That's what I want to know. I want to know their starting point. And I suggest you know your starting point, not what your competitors are doing, not what you want to do. No, in other words, know where you're at. So you got to find your starting point. And so then I say, okay, that's where we're going to start. Whatever number of visits, that when you just start to feel uncomfortable, I want you to back it down. So if you just start to feel uncomfortable around 12 visits, then I want you to back it down to 9 visits. If you still start to feel uncomfortable around 21 visits, then I want you to back it down. In other words, I take them when they just start to feel uncomfortable and then back it down into their comfort zone. Now, this is very important from a training standpoint, a systems standpoint. This is huge. To get into a comfort zone for to get somebody to unconscious competence is huge. And then we would do the same with money. So let's say, as an example, they say, well, I'd have no trouble recommending 10 visits for an average condition, average problem. Okay. And let's say the person says $20, say $20. So that's where they would be. They go, okay, I can recommend 10 visits at $20. So that is, and then they'd have to justify why, tell me why. Then I did 2 things. One is that would be the system they would start at. That would be what they would start recommending visit-wise, and that's what they would start recommending dollar-wise. Now, dollar-wise, I not only took that dollar amount, but I also divided it and made it smaller. So maybe instead of it being, if it was 20 visits at, or 10 visits at $20, which would be $200, then I would say break it up into 3 payments. So it's only maybe, or even 4 payments. Maybe it's only $50 a month for 4 months. So they'd only recommend 10 visits, and it's only $50 a month for 4 months. And these are just examples. I'm just giving an analogy of how to always move to the next level personally with a staff member or a doctor in any subject. And this is how I was able to do it. And I still use the same psychology on myself today all the time. It's at very different levels than 25 years ago when I started. So that would be an example. So I'd say, okay, then go ahead and recommend your 10 visits, recommend at $200, but they don't have to pay $200. They only have to pay $50 a week or $50 a month for 4 months. And that's what that doctor would start training on. And all I'm trying to do is start at their comfort level, because I need to get them psychologically past the unconscious incompetence into the conscious competence phase, where they can do the systems at a greater than a 50th percentile, but preferably an 80th percentile. And so we talked about how we quantify and measure their abilities and their skill sets. So I would say, okay, we'll do that until you have, an example might be, we'll do that until you say you have over 50% prepay. In other words, the patients totally agree and accept it. And so that goes on. And then we evaluate, and then all the systems are taught until that person had that ability. And 50% is a little bit of a lower mark. But anyway, you have to have a number. You have to quantify this. So then I'd say after you have over 50% of your people prepaying at 10 visits at $50 a month for 4 months, well, what happens is now they go into the conscious competence and the unconscious competence phase. Their knowledge and skill level now elevates to that level with the subject material. And so we didn't introduce anything frightening or that was difficult or any paradigm shifts at all. The first objective was to get them to be able to go through the activity. That was the only objective when we start out training. That's the only objective, be able to go through the activity. So once you start adding time and money and they have to learn the activity, now you have 3 different areas that can go wrong, and they will go wrong. So you got to be highly aware as a trainer. We're dealing with time or money. Remember, those are high confrontational subjects. And then we're dealing with the knowledge base of the material. So we've got 3 different issues that we're dealing with here as a trainer. Well, all I'm doing is I'm eliminating the money and the time, putting it into a comfort zone, and I just want them into the unconscious competence phase, or really the conscious competence phase of that skill set. And let's say over 50% is what we'd quantify, say prepay or accepted conditions. Now, once they did that, I'm ready for the next step now. Now, I have to train into, I got to go into the why of visits. In other words, I have to go into education, repetitive education with the 3 phases of healing, because that person's psychology has to change. Because if they think and always think that the average patient needs 10 visits, then that's only what they'll ever be able to do. So now I start with their education and educate them on the 3 phases of healing. Now, what's so important about that is I don't go to the pleasure part of the education, I go to the pain part. So I go to the education of, why we're doing what we're doing and how we're doing from a sense of duty and science. So I'll stay at the higher levels of communication. But then I'll go into all the problems they're causing. In other words, all the pain they're creating by having low confrontation and low conviction of time or money, and how they're actually hurting people because of their low conviction and low confrontation. That is the angle of motivation that I will go at, because it is way more, remember, it's way more motivating to get people to see the facts or the science of in other words, the duty and the facts and the science, and then get them to see how they're actually hurting people, and they're hurting them on a very personal, private level, not just superficial. In other words, their primary needs. Now there's permanent injuries in their primary needs because they've got low confrontation or conviction and not willing to talk about visits or money. And so this is some of the psychology in training that I'm using. I'll use it with staff members, but importantly, very importantly, with patient retention. So we're going to educate to the 3 phases of healing for the average, and then I'll lowball the average. So if you took the average, a young patient with no previous injury, then I would do the minimum visits in the inflammation phase, the minimum visits in the repair phase, the minimum visits in the remodel phase. And I would do the opposite. Okay, what about the old patient with long, extensive injuries? Then it'd be the maximum visits. And then I would go in between, just pick the one right in between, and then I'd go, okay, and so that would be taught in, but then I'd make sure it was taught in that they knew, number one, they knew the science of it, because if they didn't know the science of it, there's no belief system in it. And then 2 is I'd let them, making sure they're highly aware on a very personal, emotional level. how they're hurting, not pleasure, the pain of how they're hurting that patient by not sharing this information and not in other words, not having a better skill set, not having a better knowledge base, and not having low confrontation or low conviction. See, that's what motivates people. I will always educate and make the offer, but I'll use these techniques, these psychological techniques. And the number one reason I'm motivated to do it is because I know they're going to have a permanent injury and they're never going to hear this again in their life. This is probably the only chance they're going to hear this information in their life. And chances are they're going to have a primary restricted need in their sleep or their work activities if I do not share this activity. So that's a huge sense of duty that I impose on myself. That's how I was able to continually and easily give them the information. And there's no problem with that. Now, when it comes to money, when it comes to time, that's just how people heal. Then the other factor I'd look at is their value system. Okay, well, what are they in placing their value system on with their time and money? And if you look at that, it's pretty disgusting what people spend their time on and what people spend their money on. That helps destroy their life way more than chiropractic and physical medicine, which will not only help relieve their pain and discomfort, but prevent a possible permanent injury in a primary condition. So then we'll look at their value system. And this helps put it in perspective. But getting to the point here is that's how I started. And then here's what I would do is I'd look at the stats. And then you got two parameters. You got two different control mechanisms. You got visits and money. And they are totally separate, and you need to understand they're separate. You have to use them separately. Because if the person believes, they should have more visits, but now they have a problem because they don't believe in the money. They have a hard time talking about money. They've got some confrontation issues with money. See, one will pull the other one down, and what you need to do is understand that there are two separate entities, and you need to separate them out in your training. And so here's what you do, is I found their normal, make sure their skill set was where it needed to be. We objectively quantified, get them over 50%. Make sure they're being educated, get them to see the pain-based problems for them not doing the activity, number one. But then we'd do two things. We did what I'm real big into, what's called micro steps. Micro steps. You will be able to do a lot more in life micro stepping than taking major leaps. Major leaps is when you typically get batted back down and you never try it again in your life. So micro steps will take you to the promised land. And so we teach micro steps. And so now that person, say they recommended 10 visits, then I'll say, well, do you feel comfortable recommending 12 visits or 13? I won't go very much at all. Not much at all. Do you recommend maybe 12 visits? They go, yeah, okay, let's do 12 visits. Okay, so we did a micro step with the visits, and we're in a comfort zone here. So, and remember, we're over a 50 percentile in their skill set and efficiency. I never would have increased those visits. Then the next psychology is the money. Well, now I'm going to tabulate the money and go, okay, well, now it's 12 visits, so it's $240. So I'm going to pay attention with that money figure, because if the money figure is uncomfortable for them, it'll draw back their visits. It'll have nothing to do with the conviction of the visits. It has to do with money. So you need to understand these two concepts and separate them out. And so what I'll do then is I'll go to terms with the money. I'll always make sure the money is under their confrontation level by going to terms. So as an example, let's say the money was up to wherever they were uncomfortable. Let's say over $200 a month for them was uncomfortable that they were asking for. Then I would extend it to another month to bring down that dollar amount so it was under $200 a month to keep it in their comfort zone. That's how I constantly was able to manage and leverage visits and money. That was the system I used. And we were able to just regularly monitor and patrol the doctors, and regularly they just move them right up the chart in their efficiency levels and their conviction levels and their ability to talk time and money. That's called being a good trainer. And so I'm paying attention of three total different entities. One is the material itself, the objectives, and remember I'm quantifying them on a scale of 1 to 10, how well to do. Then I'm looking at the time, the recommended visits, and that's a purely conviction issue. And money is a confrontation issue. So we got three different issues here. So I'm eliminating the time and money to get the system down into the conscious competence phase. Then I'm going to start maneuvering micro steps with time and money, micro steps. But when you move one, be careful because money may tip over into the other one. And the example is if their perception of asking for more than $200 was too much, then instead of 3 months, I go to 4 months. So it wouldn't be $200 a month. Now it'd be what would that be? 150, 4, 550, be like 165, something like that. But I'm keeping it under their psychology of confrontation so they don't quit and stop. And then what happens is the same thing. So now their skill level of taking them through the system was good because, you know, that wasn't, we got them there first. That's the first objective, is get them through the system level first. Then get their comfort level with visits and money, get their efficiency level over that amount, and then micro step the visit, then take the money and make sure it doesn't go past what they're comfortable. If it does, then break it into another term. Now, when you keep doing that, that's when conviction, confrontation, skill level, everything just keeps going up. And then down the road, you can even bring up as their conviction and their confidence grows. You know, maybe they got a treatment plan of 6 months now because that's what you had to do to talk about the money to equal the visits, right? So it might be out there a little more. Well, now, instead of moving one of those up, now I'll just move in instead of 6 months. Now I'll just make it 5 months. Then I'll start working on it from that angle. I'll start working out. So I'll leave the visits the same. Then I'll just bring the money in. So the money comes up. The money stayed the same, but perceptually, the monthly figure changed, and it challenges them just a little bit. So that's the stair-stepping method of training, how I'm going to pay attention as a trainer with patient. Now, the example I'm giving is patient retention, dealing with patient retention and number of visits and money. But the example that I cited is transferable to everything. It's transferable to you. It's transferable to your staff, the skill sets within your staff. These are the parameters. Now, in this particular case, I'm looking at the system. Okay, so we want to quantify a system and measure it and quantify it and measure it and train to it. And then when it gets to be a certain amount, then we can go into the next micro step. But I may only do one or the other. I may not do both. I'll do maybe one, leave money the same and only do visits, or maybe do money and not visits. And this is how. And then the last part of that is education. It's education of why you're doing it. More important to create value, to see why it should be there. But that's still not why people will do things. Now what creates the motivation to get them to do it is get them to see the negative, how their inadequacies are hurting people on a primary need-based system, and then take money and string it out to make it easy for them to talk money. And then all you need to do is bring money back in after their confidence and conviction goes up, and then just go from 6 months to 5 months to 4 months to 3 months, whatever it is you're going to do. And this is how you can constantly move and change your skill set level. And it happens rather quickly when you understand the psychology of this and you apply it. Because typically what happens in the masses is they don't understand the psychology. And they don't do it because they either don't know it, or it's too big of a paradigm shift so they don't attempt it. Or they attempt it and there's huge negative feedback because now there's too many variables and there's huge negative feedback, and so you go into what's called rationalization justification. It's not their fault, it's the system's fault. I'm in a bad area, my community's not chiropractic minded, health minded, wellness minded, you know, bad insurance. Those are all that's the same crap all chiropractors say that don't do well. And it really has to do with your conviction and your motivation and your confrontation level. So just want to make sure we're real clear on these parameters of training and how to micro-step people and the psychology that I've used to train just hundreds of staff members and doctors, and just literally take them in short periods of time, you know, anywhere from 3 months. It can really happen fast. One other little clue I want to point out to you is a common mistake after you do that is the person gets confident. They get overconfident too fast. And then they instead of another micro step, they jump too much. And typically that's when there's huge negative feedback and it brings them back down. That's a very common phenomenon I forget what the name of it is, but it's a very common phenomenon with all forms of training. When there's a little bit of confidence that people jump too high, and usually they don't have the knowledge or experience or skill level, and the negative experience is too big and it beats them back down. Now, of course, the bad news is if they stay down. That's the bad news. So that's a little bit of the psychology, and these are very important psychological principles to break down the psychology of the conscious and subconscious mind, to manage and train, to move your staff members and move associate doctors, and more importantly, move you into whatever direction you want to go. And of course, what this does is helps, number one, all of this helps to do the first component of wealth, which is maximize your exchange of time for money. That's the first thing it does. And then the second thing it does, it helps to maximize your time for money. That's what this psychology does. And then, of course, the next level is leveraging your money and your time. And these are the psychological principles that we use to go through all of them, to attack each of these fears, inhibitions, and confrontations and convictions, just a little at a time. And that's how we did it.